repair shed, and then upstairs on the threshing floor. So you have right here set up are all the tools that would have been generally available to the surgeon at a field hospital. And where we're actually set up, this is the actual location where they conducted surgery. Four tables were set in this under the eave here, and operated during and immediately following the battle. So what we have is a variety of tools. Again, these aren't the tools that would have been at a field dressing station. You'll see those inside. These would have been the ones that they would have used at a field hospital. You may have even found some additionals to this, and certainly at a general hospital after evacuation, there would have been the potential of more tools. Yesterday, someone said this looks like a carpenter's toolkit, but every tool had a specified use. And if you learn about the tools, you realize the tools are designed to reduce trauma rather than induce trauma. Most people stop and they take a look at something like the capital bone saw and think, oh my gosh. But with amputation being common, and it was not something that was just a patient's brought out to a surgeon and they say, well, I'm going to amputate. That had to be done under consulting. So each table would have had a surgeon, an assistant surgeon, and then the orderly. The orderly would have basically been like today's nurse anesthetist or something. But both surgeons would have to agree that amputation was the best course of action. What makes it a best course of action is certainly survivability, quality of life, and unfortunately, time. When soldiers were brought in, they were triaged, and those that could not be helped were separated, usually given pain meds and sent to a dying tree. The rest were staged for treatment. And those treatments typically were extremities, so arms and legs, which is one of the reasons that we see such an increase in amputations during the time. But again, it's not hack and slash. Even in amputation, there's a strong attempt to improve patient quality of life post-surgery. So I know like a tool like this rongère, it looks grim. But after the wound was open, if you're going to amputate and say you're using a circular cut, so you're using like a Liston knife like this, I know it looks large, but it's to make a rapid cut. And then before you would actually saw, you would retract the flesh several inches up. So you'd actually have to use the knife again, or a smaller knife, to basically fillet the bone to be able to retract the muscle. You would saw through, but if you think about any kind of cut meat that has bone in it at the grocery store, it's always got sharp edges. The rongère, or bone-gnawing forceps, was designed to actually trim away that rough edge. Then you have a series of files you can use, bone files, to smooth it. You could have ligatures pre-tied onto a tenaculum to rapidly pull a bleeder, a vessel, a vein, and artery, and slide that over and tie it off rapidly. Then release the tension, and you would actually allow that flesh, that mixture of muscle and bone and tissue, to cover over that now smoothed surface. So that post-operative, when an individual was healed and getting fit for a prosthetic, they didn't always have something sharp inside poking at them. So there was great care taken. It's not, again, the common butchery that's perceived. Our goal here is to really dispel a lot of the myths that it was hack and slash, or that guys were awake when surgery happened. If you think about it, if I'm grabbing a knife like this to do a circular cut, I'm getting cut and you're getting cut, right? So without a doubt, chloroform, well, ether was used at some points, but that's really flammable, so it's not a great thing. Yeah. So chloroform was used. You could use a ether cone in about 8 to 12 large drops. Didn't matter if you were the smallest guy in the line or the largest. Place that over, and you didn't go into unconsciousness. That's why the myth persists. They learned early on, much of Civil War medicine is best practice. Wow, that didn't work. Let's not do it again. Hey, that works. Let's do that again. They realized that they knocked people all the way out. They struggled to wake them back up. 1. 2, if they were out and too long, they had increased incidence of postoperative pneumonia. Consider in modern surgery, when you come out of surgery, how often is there a nurse in front of you poking you as you're trying to open your eyes, shoving a hose in your mouth saying, make the ball, go up. Well, you're trying to expirate your lungs. They didn't understand that, but they did understand, wow, if I knock you all the way out and recede your breathing too much, you get sick after. So the myth persists because someone unknowing walks up onto a surgical field like this with 4 tables, and the guy's maybe laying here getting his lower arm amputated. He's saying, hey, doc, what are you doing? Where's Joe? And the next guy's singing a nursery rhyme from when he was 3, and the other guy's still yelling about what was going on the battlefield. They are not mentally in the room.
Right.
The term doctors used was insensible to pain.
They're calling, a lot of them are calling for their mothers.
Yes.
I did that. Actually, when I got my mother's pulled me out, I was like, oh.
Yeah. Well, you weren't fully in your mind anymore. You're somewhere else. Exactly. So, yeah, these are the tools. Ask questions as you will. Dr. Willen, and I call him that because he's actually a doctor, can explain some of the procedures that were done and how they would have been done, the tools, how they would have been used. Feel free to ask questions.
I could show you how they did it if you're interested.
Sure. I've been here. They used to have a field hospitals out here years back. You know, like big fences.
Mm-hmm.
Well,
And
we used to, we've been coming
Dr.
here.
Annabelle? Dr. Annabelle?
Yeah, I know.
That was years ago.
In fact, Jackie, one of our nurses, she always used to come with him. But we've been coming since the second year. We used to set up over there too.
Nice.
in reality, I guess the actual, like the hospital tents were most likely set up across this rise here once the artillery had left. Because it was stationed. Artillery, yeah, reserve artillery was staged up there.
Also, besides being the hospital, was the artillery reserve. So Hunt, when he needed more artillery, he would get them from here and move them to any place that was needed. In fact, there's a book about this place called Too Much for Human Endurance.
I just bought it.
Yeah,
I watch them on YouTube all the time.
Yeah,
I
yeah.
gotta get
Well,
them.
Ron, I actually
Ron.
reviewed the medical parts of that manuscript for Ron, but the point is he has got a second book in the works just about the military, the artillery, and all the other stuff that went on.
Oh, wow.
Yeah, in fact, he was. I had him as a speaker by then until he wants to speak again on his new thing. Anyhow,
I like to meet him.
He's a nice fellow.
he's a docent here.
He's often around.
Actually, he was here 2 weeks ago. He did a book signing at the visitor center, and he was showing people around here.